functional. Yeah, and that's what I would like. I would like for you to make my toenails not so painful and more functional.
So I'm going to go after this one a little chunk at a time.
Okay, now if I jerk,
I'm
it's
used to it.
because of my back.
Okay, if you need me to kind of stop for a minute,
No,
you just
but
let me know.
I just want you to be aware I do jerk.
Yep. Okay.
I'll do some deep breathing.
Yeah, there are people that tell me coming to the podiatrist is worse than going to the dentist for them. Yep, I think those hit the wall.
I think the dentist, when they're going to do something, you know, they numb you up, so
Mhm.
you don't really feel it.
Yeah. And for this, we shouldn't need to. I'm just trying to keep this in the frame. I don't like doing my own videoing because then I'm looking at your foot and I'm also looking at the camera to make sure you're still in frame. But
Well, the most important is the toe.
right. Whoop, that hit you?
No, my eyes are closed.
Okay.
And I have glasses on. Oh, they do shoot, don't they?
They do.
You know what you're doing, and I think the LPN that was cutting toenails was probably afraid to start to do anything like this.
Yeah. Well, as well she should be, unless she's got special training, which some do.
Or she, no. So, you know, she knows that. Oh,
So we got lots of big chunks coming off, which is what we want.
mm-hmm.
I'm not going to go too much deeper because then I'll use the sander and we'll thin them out.
Okay.
Now, it will never be this difficult again when you come in
Okay.
if we keep you on a regular schedule.
Yes.
So I know this is pretty uncomfortable today.
Well, I expected if you took them off, it would be more uncomfortable. So,
Well, if I
This
took
is
them
so
off,
much better.
yeah, if I took it off, I would numb you. But
yes. It took months when that one podiatrist took off the sides.
mm-hmm.
Took months for that to heal.
Yeah, and especially for that reason, I don't think we need to remove these. I think we'll be able to get you way more comfortable just by trimming.
Okay. And why have the pads in my heel gone so flat?
Well, losing the fat pad in our feet, up in the ball of the foot or in the heel, that is something that can happen just with age. And it tends to be genetic.
Oh.
And so people will say, yep, I remember my mom complaining
Mm-hmm.
when she was this age, or
So my sons could have this.
they might. Sorry,
It's
sorry,
gonna
sorry.
feel so much better, isn't it?
It's going to.
That one little nub was bleeding now. She tries to get, but it's in there.
Nope, you're fine. Okay, so a while ago you had a stroke, right?
Yes, yes.
Okay, and you can't lift this foot up anymore, correct?
No, right, correct.
Okay, so you have what's called an AFO or an ankle foot orthosis, and we'll get a picture of that in a minute. But so you just put a lot of extra pressure right under that bone right there. And does this make it difficult for you to walk on?
Yes, does.
Okay, and so we tend to trim this like every month or so to keep you walking as much as you can, right?
Yes, yes.
And does that help?
Yeah, it does.
Okay. Do you do anything for this at home?
No,
Okay. So after I trim most of the callus off of this, how long does this keep you comfortable?
for about a week or two.
That's all, huh?
Yes.
Okay. Should do it. And we've had an open sore under this in the past when it got too thick, correct?
Yeah.
Okay, and that's why we have you come in every month just to keep the callus down. All right, well, thank you for letting us do the video.
You're more than welcome.
So this, because if diabetics are not feeling what's going on, and it's a good habit to get into now, even though you still do feel the bottoms of your feet, that's how people lose toes and lose legs, is that they get infected and they don't get in till it's too late. Now, if anything I'm doing here is hurting you, let me know.
That hurts a little bit, but it's a tough one.
Okay. Yeah, I'll be able to thin this out for you,
Good.
and it should feel a whole lot better. We've got our squeaky clipper again here. Are you working?
I'm retired.
Okay. What did you do?
I did data entry and research
For.
with an insurance company.
Ah, okay. So you're a numbers person.
Not really.
And what are you doing that's fun in your retirement?
Oh,
Traveling, grandkids.
grandkids. Setting up my home still, I've just been there for not even 2 years, so I'm still doing things.
Nice. Okay, let's go the other side. This. So we're gonna take some of it, but now if I try and take it all down, I'm gonna cause a lot of bleeding if these are psoriatic plaques, we call them. So I'm not gonna go as close as I would if it were just a plain old callus.
Okay.
'Cause I don't want you going home a bloody mess.
Is psoriasis the same as dandruff?
Psoriasis can cause the scaling that causes dandruff, yes. So I don't see anything here that's going deep enough now to worry about this all getting infected again. And the infection does look like it's kind of gone, so let me smooth this out. So if you look right here, you can see there's just a little teeny bit of bleeding right there. And that's because these are the psoriasis scales and not just plain old callus, so I'm gonna stop here. But what we'll do is we'll get you back in a couple of weeks to do this again. And let's get this one.
Now that might jerk more this right foot.
Okay. Yeah, these will look better when, after we thin them out. They don't
Yeah.
look great right at the second.
Or just having less pain from that heavy, thick, it's like you put a clothespin on there and squeeze.
Exactly. And then your shoe is always pressing, or the
Yes.
sheets, and
Yes.
Yeah.
I have to be careful about the shoes that I wear. And sometimes I've been wearing more of a thinner dress shoe than I should be.
which doesn't help your heel pain, given
No,
that
it
a thin
doesn't.
dress shoe usually has a very
Thin.
thin leather sole.
Yeah. I used to buy shoes only for looks. Remember when I used to travel and work, and one time when I was in Toronto, I went to that big mall downtown with the glass dome and found a pair of red, oh, it must have been 2.5 or 3 inch heels with gold crisscross. They were the most beautiful shoes.
Mm-hmm.
They were the most expensive shoes I've ever bought. I would only wear them very few times. And then a lady drove her car on a divided highway in Milwaukee. I was going 45, the speed limit. I always set the cruise control. She drove out from a side road, a 90-year-old lady that should not have been driving, and totaled my car.
Oh, is that what happened to your
That
back?
was the impact that started the decline of my back. I worked for 10 more years and then my body completely shut down. Very painful times. And during all of that, my feet were also very painful because the nerves in my body, they cut on the diagonal from around my belly button all the way up to my shoulder blade, and then from my neck down to my tailbone. And then I've had more surgeries after that, and then the cervical neck. So the nerves in my body have been damaged so much that I always wear a brace support because I have no core.
Mm-hmm.
I have atrophy in those muscles.
Because they had to go right through them to get to your spine, huh?
They sure did. Now they've learned not to diagonal but to cut straight
Mm-hmm.
when they do the low back. But it has really took years for the nerves in my body to calm down. And my feet, the nerves in my feet, they put a rod through to make sure I wouldn't have drop foot. Thank you very much. And I don't have drop foot. But my feet have been not good ever since.
Well, your muscle strength in your legs and your feet is pretty good.
And do you think that's because I exercise and keep walking?
Definitely.
And so I just have to do that. I don't want to end up in a wheelchair before my day.
Right.
Now that I've gotten out of one.
How long were you in a wheelchair?
Well, after the surgery, I was in the hospital, and then I was in a rehab transitional care,
Okay.
and then I was in a hospital bed, and then in a wheelchair because they took me.
Now this might also make your foot jump. Don't worry if it does.
Okay, we got.
I gotcha.
Oh, that's not so bad. Now, they probably won't grow longer, but they'll grow thicker again.
They'll grow longer as well
Oh, they will.
with
grow
time,
longer.
yeah. A little bit. So you see how these nails, not a topical is not gonna work for you anymore. The fungus is all the way back now under the cuticle here where the nail grows from. So the nail back here is being made with the fungus already in it. So for nails like these, a topical is not gonna work for you. And if you wanted to talk about doing oral medication, we could have that conversation about the pros and cons of doing that. And we can make a big difference with how nails look. And, you know, the thickness and the discoloration. With the oral medications, we really can make a difference.
I'll wait on that.
Okay. Yeah, let's just see if we keep you comfortable with just the regular diabetic routine care and trimming. Maybe it won't even be an issue that you feel like you need to discuss.